After about the age of 30, you may notice you have these tiny red or blue veins on your body, maybe on your legs, perhaps on your face. They're called spider veins. But did you know there is a simple way to have them removed? I'm at the office of Dr. Robert J. Davis, plastic surgeon, and joining me is physician assistant Rebecca Ospedal. Thank you so much. First of all, let's start with, what are spider veins?
Spider veins are dilated vessels on the surface of the skin. In fact, we have an example right here. On the leg right here, you can just see a couple of fine, small, light purple veins. Sometimes they can get a little bit larger, darker in color, anywhere from a purple to a green to a red. And these are an easy area to take care of.
Yeah, and I know I've found them on my legs, especially around the knee.
That's right, very common. Upper thigh, knee, and ankles as far as the body's concerned. And then on the face, we get a lot of broken blood vessels as well.
What causes spider veins?
There's a number of things that cause these spider veins. Environmental exposure to extreme cold or sun, hormones, trauma such as contusions or surgery, chemotherapy, radiation, and probably my most common is an acne rosacea, because this affects a lot of my male and female patients around 30 to 60 years old. Comes on the face, small broken blood vessels called telangiectasias. Laser, one of our treatments, is a wonderful way to eradicate these spider veins.
Right, and you do have the laser treatment.
I do.
Tell me about that.
I do. So this is our Gemini laser, and I'm going to take care of this area here. So let's just put on our laser safety wear goggles. And the first thing I'm going to do is just apply a little bit of aloe to this area. And then I already have my parameters set up based on the type of skin my patient has, the color and the size of her vessels, and the power that I need to treat. And what I'm going to do is I'm just going to trace along these areas, and we're just looking to blanch out these vessels, which in turn will traumatize the vessels themselves. The walls will collapse, and then blood flow will no longer be allowed to go through these. The patients do feel a little bit of some heat, a little pinprick, but most of my patients find it very tolerable. They actually do come back, so that's the good news.
Yeah. And you say each visit takes about 15 minutes?
I do about a trial of 15 minutes, and what we'll do is I usually tell my patients we'll do one treatment, and it can take on average 1 to 3 treatments to really eradicate the problem area. We space it a month apart, so I have them come back in 1 month. We reevaluate, and if they choose to, we can retreat at that time. What I find after the laser is that sometimes all they'll be left with is just maybe a little bit of redness, a little bit of swelling, but then they're welcome to go back and just have their normal activities.
Yeah, but there is a little bit of aftercare.
There's some aftercare. We always talk about wearing some compression hose to help keep the vessel walls tight, and to refrain from cardio activity. And one very important thing I forgot to mention, laser is probably most successful on fairer skin types, so non-tan skin, fair complexion. When we get to darker skin, or even tan skin if you will, we run the risk of hypo or hyperpigmenting the skin, darkening or lightening of the skin, some of which can be temporary, some which can be permanent. So the summer is not the best time to do laser treatments. I tell my patients to come see me in the fall. The fall, winter, and spring are the best time to treat with laser.
Now, this is not the only treatment you have. You have another injection that you actually use.
We do. We have something called sclerotherapy, and this is okay for all of my skin types any time of year. We use a product called a sclera, and it just comes in different sizes based on how big the vessel is that I'm treating. It is done with a little bit of a needle stick. You feel a little bit of a ouch when I go in. Patients tolerate it very well. You get numb as we go along. Like the laser, we do have some redness afterwards, some swelling, a chance of bruising. The support care after is relatively the same. We encourage compression hose for about 3 to 7 days and refraining from cardio activity for 3 days.
So a lot of us have the spider veins. Is there any way to prevent them?
There's not a foolproof way to prevent, but we can do what we can do with some sunscreen. I know this sounds simple, but if we just protect our skin from the sun, which is the #1 trauma, especially to the face, we can help prevent some of these spider veins from showing. So head to toe, protect yourself from the sun. In fact, even doing either laser or sclerotherapy treatments, we advise our patients to wear sunscreen on those areas because again, we want to protect what we've treated. Let's make it worth your time.
So 2 treatments, both done in the office in a short amount of time, and both relatively painless.
Relatively painless. There's certain treatments it's best to come in for a consult, see what size vessels you have. We talk about which treatment would be best for you, laser versus sclerotherapy. You can also do both together at one time. Everybody gets their own plan to see what would work best for their problem areas.
All right, thank you very much, Rebecca. And if you would like some more information on either of these treatments, go on to our website. You can also get some information there about Dr. Robert J. Davis, plastic surgeon. DelmarvaLife.com, click on the show tab.
Well, up next on Delmarva Life, from your hair to your feet, Bad Hair Day has tips and tricks for healthy summer skin. Delmarva Life, life at its best, here on Delmarva.